Hello, everyone. I'm Denise Reslow. I'm the Assessment Specialist for PAEA. Today, I'm going to present PAEA End of Curriculum Exam, a brief overview. So I start here with 37 because to date, 37 PA educators wrote, built, and reviewed the foundational materials and content of the End of Curriculum exam. This included content experts from across the country who worked in collaboration to help develop the exam over a period of 2 years. Once again, we should reiterate the purpose of the exam. It is to assess a PA student's general medical knowledge as one component of their readiness to graduate. And I want to stress the word one, because as we know, there are other components to the summative evaluation. The exam was designed to complement other local tools that assess core medical knowledge, as well as interpersonal skills, patient care skills, and professionalism as part of the summative evaluation. So just as a quick reminder, we know the summative evaluation consists of multiple components, including but not limited to knowledge, interpersonal skills, patient care skills, and professionalism. These 4 components must be linked to your program outcomes, which leads me to the next slide. How does the PAEA End of Curriculum exam fit into the summative evaluation? If you decide to adopt the End of Curriculum exam, here is one example of linking a local program outcome to the End of Curriculum task areas and learning objectives. At the top is a local program outcome. Below, you can see how it can be linked to 2 of the learning objectives that fall under PAEA's history taking and physical exam task area. So just an overview of the format. The PAEA End of Curriculum exam is a 300-question examination built using a blueprint and content area list developed by PA educators and national exam experts. 250 of these questions are scored and 50 are unscored pre-test items for which we are collecting statistics for use on future forms. There will also be 2 forms of the exam available. We used several cross-cutting criteria, including EPAs, to guide exam development and even to assist in developing our score reports. When developing the exam, we were guided by content areas, task areas, once again EPAs, patient care setting, lifespan, and Bloom's taxonomy, which leads to a broad diversity of questions. So here you can see our End of Curriculum exam blueprint. It is 2-dimensional blueprint with both content and task areas, and in addition, across the top, we have the Entrustable Professional Activities, or EPAs. You'll notice that 250 scored items are accounted for in the blueprint. The exam was developed with key dimensions to ensure the exam is inclusive of the types of patients PAs may see, which are outlined in the guiding principles. As you can see from the tables here, there are target areas set for the entire exam across the content and task areas. So for setting, we have outpatient, inpatient, emergency department, and perioperative. For life course, we have pediatric, adult, and geriatric. Finally, we have incorporated Bloom's taxonomy with 3 consolidated areas: remember, understand and apply, along with analyze and evaluate, which assists in ensuring students who pass the exam have demonstrated a thorough mastery of content. So pilot testing. To determine the reliability and validity, the exam will have undergone 2 rounds of testing prior to the planned January 2020 launch. The first block pilot testing included 1,004 students from 24 programs representing each U.S. region. The data helped us validate the questions. The second is a full-form limited release, which will be administered this coming fall. Programs that participate are helping us collect baseline statistics from students in the last 4 months of the program. This two-step pilot testing helps us in the standard setting process, assuring us and our members this is truly a robust exam to give to our test takers. We want to call attention to the 24 programs here who have helped us collect baseline statistics. We also want to thank future programs in advance that will help us with our next phase of testing. So scoring. One unique feature of the end of curriculum exam is standard setting. Item statistics from the pilot test and limited release will form the basis for standard setting, which will develop categorical scores. The standard setting work group will set 2 categorical performance bars, one that differentiates limited medical knowledge and satisfactory medical knowledge, and a second performance bar that will differentiate satisfactory medical knowledge and advanced medical knowledge. So, policy level descriptors. You may ask, what does this all mean? For this exam, we have developed policy descriptors for each level to help you understand what each performance category means. The standard setting process helps us to set the categorical scores between each of these 3 policy levels. For this exam, we will have 3 policy level descriptors, including, as I mentioned before, limited medical knowledge, satisfactory knowledge, and advanced medical knowledge. So what about the score reports? There will be all the same reports as our other exams, including a student report, program performance report, and program composite report. This visual will appear as well and contain the national average of your student score. This will be accompanied by a scale score. Students will get feedback on their performance on each of the areas in the blueprint: content and task area, Bloom's taxonomy level, life course, and setting. We will not be giving keyword feedback since this is a summative exam. The end of curriculum exam fits into the PAEA assessment suite of exams, which will allow for a continuum of assessment. I just want to review for a minute and give the audience a brief review of the PACRAT still serves as student self-assessment. The end of rotation exams are often given at the end of Skippies to measure one component of medical knowledge. And as you can see, our newest addition is right there at the end with the PAEA end of curriculum exam. So once again, here are our 3 exams. Some of you are used to seeing them. Here we explain some key differences and how they're used, delivered, and built. As I said, by now, many of you have probably heard of our PACRAT, which is used as the self-assessment exam. In the middle, we have the end of rotation exams. And finally, as you see, once again, we have the end of curriculum exam. So just a few timeline updates. The end of curriculum exam will be available for purchase July 2019. The first administration of the exam will be in January 2020. And after this webinar, if you want to learn more, you can go to theendofcurriculum.org. And last but not least, we would like to discuss the cost. You can choose to purchase individual end of curriculum exams, and it would be $99 per exam per student, or you can purchase it as part of the student exam box, which will be of great value to programs who utilize all 3 of our assessment products. The student exam box will include 2 PACRAT exams, 10 end-of-curriculum exams, and 1 end-of-curriculum exam, which would cost $420 per student. And this concludes our formal presentation, and I want to thank everyone for listening.
And if you have any questions, feel free to reach out to us at exams@paeaonline.org or visit our website, endofcurriculum.org or paeaassessment.org. Thank you.